In this video, I will briefly discuss crying in infancy and soothing techniques that you can try at home. I will also address the importance of shaken baby prevention, as this can occur when a caregiver is overwhelmed by a crying infant. Crying is a normal response for babies to communicate their needs or to express hunger. All babies cry, especially before feeding, when they are hungry. In their first few months of life, the average baby will cry about 1 to 2 hours per day, even up to 3 hours per day. As long as they are happy and content when they're not crying and they're able to be consoled, this is completely normal. If your infant hasn't eaten in about 1.5 to 2 hours or so, then they may be hungry. If your infant is crying and specifically cueing for feeds, then you may want to try to feed them first. Infant cues due to hunger typically appear with more alert or awake periods. The infant will bring their hands to their mouth, turning their head to look for the breast, and making sucking motions. If they are making those cues, it's completely appropriate to try to feed them. Your infant may also have a wet or a dirty diaper, so changing their diaper is another great step to provide comfort. Babies tend to respond well to comfort measures that soothe them. Try holding your baby to calm them. You can also rock your child in a rocking chair, cradle, or even while standing. Many babies calm with tiny, rapid movements or vibrations. Going for a walk with the stroller or using a newborn swing are great soothing techniques. You can provide your infant with a pacifier, gentle massage, or a warm bath to help soothe them as well. If your infant is under 2 to 3 months of age, you can swaddle them for comfort. Swaddling is very helpful when calming crying babies and can be done by semi-tightly wrapping your baby with a blanket. Be sure to not cover your baby's head and make sure that you do not overheat your baby. White noise can be paired with holding or swaddling to help calm your baby. Examples of white noise are fans, or CDs with light music, sound machines, or even a vacuum. Avoid loud volumes when using white noise because infants tend to be sensitive to sounds, so lower volumes are best. Colic is described as excessive crying, which occurs frequently and typically greater than 3 hours per day. Contact your child's provider if you think your infant is excessively crying or may have colic. Sometimes this can be normal. However, it's important to ensure that your baby is healthy and rule out any other potential causes of discomfort. A crying baby can be very upsetting and frustrating. It's important to note that you should never shake a baby, as this can cause severe medical consequences like brain bleeding or brain damage. If frustrated or overwhelmed by a crying baby, there are steps that you can take to prevent shaken baby syndrome. The first thing you can do is remember that the safest thing is to place your baby in a safe space, such as a crib, a bassinet, or a firm, safe surface like a carpeted floor. At that time, you can walk away momentarily. It's okay to let your baby cry, but make sure that you're checking in on them frequently. Next, take a deep breath. Taking a deep breath can help relax and calm you during a frustrating or stressful situation. Lastly, you can call a friend or family member to help watch your infant so you can take a break. It can be helpful to make a list of people that you could reach out to if you do need to take a break. Now we have reviewed crying in the newborn, soothing techniques, and how to prevent shaken baby syndrome. Thanks for watching.